Good morning. We continue with our heart failure awareness series, and today we ask, are you at risk of developing heart failure? In heart failure staging, we talk of stage A heart failure. These are the people who have no symptoms, have not yet developed heart failure, but they are at risk. And if nothing is done, they will progress to getting heart failure. So are you at risk of getting heart failure? Heart failure does not just occur suddenly. It happens over years of the risks that are not controlled. So it's important to know if you are at risk so that you can act. So what are those risk factors of heart failure? We classify the risk factors into two. We have modifiable and non-modifiable risk factors. Non-modifiable risk factors are the risk factors that you cannot do anything about. These are things like age. Increase in age increases your risk of getting heart failure. So for men over 55, they are at increased risk, and for women over 65, however, you can still get heart failure in the younger age groups. Gender, being male is also an increased risk, and they get heart failure at younger ages. However, women also present later, but with more complications like heart failure with preserved ejection fraction is more in women. Family history. If you have history of heart disease in your family, this puts you at risk, and you need to be aware so that you can act more on the risks to prevent. So age, gender, family history, and genetics, you cannot do anything about those, but it's important to know if you have those risks so that you can act more. What of the modifiable risk factors? These are the risk factors in your control, things that you can act about. High blood pressure, that is the number one culprit in causing heart failure. It increases your risk of heart failure by about 3 times. And treating hypertension reduces heart failure by about 50%. So if you're hypertensive, you are in stage A heart failure. You need to treat that hypertension and treat to the right targets so that you cannot develop heart failure. Diabetes also increases the risk by 2 to 5 times. It can affect the heart muscle. It can also affect the arteries. So if you are diabetic, it's not just taking the medications, it's taking the medication, ensuring your sugar is controlled, and part of your management should be assessing the heart. Weight. Excess weight, obesity damages the vessels and also the heart, and obesity is associated with heart failure with preserved ejection fraction. So if your weight is on the higher side, that is also modifiable. You can do something about it. Smoking is a major risk factor for cardiac disease. For people who smoke, your risk is very high, not just for hypertension, risk for heart attack, not just a risk for heart failure, heart attack, strokes in smoking. That is also in your control. If you smoke, you need to stop smoking. Chronic kidney disease, that also increases your risk of heart failure. Alcohol, excess alcohol. In the courses we talked about alcoholic cardiomyopathy. Sedentary lifestyle. You work the whole day seated in an office. You need to be active. It weakens your heart. Sitting for long is the new smoking. You need to start getting active so that you improve your cardiovascular health. And healthy diet, excess processed foods, excess sugar, excess salt, this will increase your blood pressure, it will increase your weight, it will increase your cholesterol, all those which will act as risk. So please note, modifiable are in your control. You cannot do anything about non-modifiable, but modifiable risks, high blood pressure, diabetes, excess weight, smoking, alcohol, sedentary lifestyle, and healthy diet, all these are in control. And you have said people with risk factors are stage A heart failure. So if you have one or more risk factors, your risk is high, you are stage A heart failure, and you need to act. The good news is that you can reduce these risk factors by smart choices. We have said treating hypertension reduces heart failure by about hypertension. So how do you control this? Control your blood pressure, control your blood sugar, stay active, eat healthy, quit smoking, limit your alcohol, lifestyle changes, and these are for life, not just for a short time. So we need to put those lifestyle measures so that you do not come to us later when you have gotten heart failure, and this would have been prevented. And note, if you have any of those risks, you need, as part of your management, to be having heart assessment. If you're hypertensive, ensure at least once a year you have an ECG done, or even an echocardiogram. So please remind your doctor who follows you, if you have any of the risks, are we assessing your heart health so that you do not come back with heart failure? So which risk factor do you think you underestimate, and what actions are you going to take to prevent yourself from developing heart failure? So stay tuned. In episode 4, we will talk of the symptoms that people ignore, signs that your body may be sending and you need to act. Dr. Beatrice Muthui-Mutua, saving lives one heart at a time.